So good evening, everyone, and welcome back to another episode of the Healthy Reset, where we discuss the topic of menopause and all the things that women need to do to help them navigate this journey of menopause. All right, so tonight I unfortunately have some bad news. Our guest speaker, Pamela Cohen, wasn't able to come on because she had a late emergency that she apologized for not being here. So she's going to reschedule for another day. That being said, I asked Nurse Maria if she can come on and talk to us tonight about a topic, and her topic of choice has been hair loss that happens during menopause. So I'm going to turn you over to Nurse Maria and let her take it away about the hair loss during menopause. Maria, the floor is yours. I think you're muted, Maria. So we're waiting for Maria to unmute herself. If anybody
Okay.
has any questions, just put, yes,
You all
Maria, we can
hear me
hear
now?
you. Yes, we are hearing you quite clear. Anybody have any questions, put it in the chat. Or if you're on YouTube, just put it in the chat box there. We'll try to answer them in a timely fashion. But if you have any questions, put it in the chat. And if you want to ask a question, you can always raise your hand. So Maria, it is all up to you.
Ladies, a special good night to everyone. I want to deal with a topic that a lot of women have to deal with during this time of their life, which is hair loss during menopause. It is something that can be very body altering, because hair is so much of a part of a woman's beauty. And to have hair loss at any time in your life, it could be very, very, very frustrating. So there are steps that we can take to treat hair loss and to improve the quality of hair during menopause. As we know, menopause is a natural biological process that all women experience at some point in their lives. During this time, the body goes through numerous physical changes. It adjusts to fluctuating hormone levels. Many women have unpleasant symptoms during menopause, including the very famous hot flashes, mood swings, insomnia. Hair loss is another common occurrence. Hair loss during menopause tends to be a bit more subtle in women more than in men. Most women experience overall hair thinning rather than noticeable bald spots. The thinning can occur on the front, sides, or the top of the head. Hair may also fall out in large clumps during brushing and or showering. Some research suggests that hair loss during menopause is the result of hormonal imbalance, specifically related to lower production of estrogen and progesterone. These hormones help hair grow faster and stay on the head for longer periods of time. When the levels of estrogen and progesterone drop, hair grows more slowly and becomes much thinner. A decrease in these hormones also triggers an increase in the production of androgens, or a group of male hormones. Yes, that is what I said, male hormones. Androgens, what they do, shrink the hair follicles, resulting in hair loss on the head. Now, in some cases, however, these hormones can cause more hair loss, more hair to grow on the face. This is why some menopausal women develop what we call facial peach fuzz and small sprouts of hair on the chin. For women going through menopause, the cause of hair loss is almost always related to hormonal changes. However, there are many other factors that can contribute to hair loss during menopause, which include high levels of stress. Remember, we spoke about cortisol, ladies. This cortisol, which is the stress hormone, this is one of the things, or one of the problems that could come due to stress and increased cortisol levels. Extreme high levels of stress, illness, or it could be a lack of certain nutrients. Diagnostic blood tests can help rule out other causes of hair loss, which include thyroid tests and or a complete blood count. Hair loss may make you feel very self-conscious about your physical appearance, but the condition isn't permanent. What are some of the things we can implement as women to help reduce hair loss? One of the such things we can do is reduce stress. Now, we say, we know when, I talk to patients on a daily basis about stress and the reduction of stress. And many think it is a very impossible task, but what I would say, it is very possible once we learn various techniques as how to manage stress. And once we get stress under management, we would see very positive physical, emotional, psychological results when we are stressed out. So here we go. It's important to keep your stress levels in check to prevent a hormonal imbalance. Reduced estrogen production can affect your brain chemistry and cause mood swings, anxiety, and depression. However, doing yoga and other breathing relaxational methods are especially effective in fighting menopausal symptoms. Exercising regularly can reduce stress levels. That's one of the things you can do. We can also, the next thing you can do is get moving, start moving through exercise, which exercise is a key component of a healthy lifestyle. You'll see here that it is just not one thing that can help with menopausal symptoms. It is a very holistic approach. So get moving, exercise is another component of a healthy lifestyle. You'll feel stronger and happier once you incorporate exercise into your daily routine. It helps to prevent some of the symptoms of menopause, including mood swings, weight gain, insomnia, and all these things factor in to a lot of the symptoms we experience during menopause. And all these things that I've just said about, we talk about the mood swings, decreasing weight gain, and all these things. Once we got these things unbalanced, our bodies will eventually get in a very balanced state, and hair growth will be promoted. Choose what I was suggesting was to choose a form of exercise that works for you. What a lot of people do, if somebody recommends, let's try, let's say, let's go do gardening, or let's go running or walking. Ladies, what I suggest that you do an exercise that interests you. Why? Because if you are interested in it and you like it, you will continue. So choose an exercise or a form of exercise that works for you. You may want to consider taking a walk with a friend, or joining a gym, or going for a run, or some swimming, something that you are interested in, because you will continue once you enjoy it. Another solution we could add into a nice healthy lifestyle is eating well. Eating a balanced diet, which is a low-fat diet, is a best defense against hair loss. Make sure you include an adequate amount of grains, fruits, and veggies in every meal. It is also important to incorporate monosaturated oils such as olive oil and sesame oil into your diet. Drinking green tea and taking vitamin B6 and folic acid supplements may help restore hair growth as well. Essential fatty acids also play a crucial role in maintaining hair health. These fatty acids can be found in the following foods: salmon, tuna, flaxseed oil, walnuts, almonds. Also, there's another solution as well that could help to aid in a healthy lifestyle and could help decrease hair loss and help to bring those follicles back to life again. Hydrate, hydrate, hydrate yourself. Your body needs to be hydrated in order to function properly. Load up on water, load up on your H2O, ladies, all day long, and pass on the juices, on the sodas, and other flavored drinks. And they contain more sugar than your body needs. Now, the amount of water needed varies from one person to the next, which depends on various factors, including an individual's overall health and exercise intensity. Now, as a general rule, however, you should aim to have at least 8-ounce glasses of water per day. All right, so another solution we can do is to keep it natural. Now, in order to prevent drying and breakage, it's best to stay away from heat tools such as hair dryers and straighten irons. Extensions and other styling methods can also weaken hair and cause early hair loss when we do things too extensively. If you must dye your hair though, choose an all-natural hair color. Artificial chemicals found in dyes and perms can compromise your scalp and hair health. When you wash your hair, always use a nourishing conditioner to keep your scalp healthy and promote healthy hair growth. If you are a swimmer, make sure to wear a swimming cap, as chlorine can contribute to hair breakage. When out in the sun or the wind for extended periods of time, it's important to wear a hat to protect your hair from drying and the breakage. So I hope you ladies, we are taking note. Next step that we can take is to talk to your doctor about medications. Some medications have side effects that include hair loss. Talk to your doctor if you're experiencing significant hair loss and you think that your medication might be the cause. Your doctor might be able to switch you over to another type of medication without any reported side effects. Don't stop taking medication until you've spoken with your doctor, as this could be dangerous to your health. So this is a very timely topic, ladies, and it's one that there are a lot of solutions for. How do we treat female pattern hair loss? And this is a study, a Harvard study treating female pattern hair loss. About 1/3 of women experience hair loss, which is otherwise known as alopecia, at some time in their lives. Among postmenopausal women, as the study says, as many as 2/3 suffer from hair thinning or bald spots. Hair loss in women often has greater impact than hair loss does on men because it's less socially acceptable for them. Alopecia can severely affect a woman's emotional well-being and quality of life. The main type of hair loss in women is the same as it is in men. It is called androgenic alopecia or female pattern hair loss. In men, hair loss usually begins above the temples and the receding hairline eventually forms a characteristic M shape. Hair at the top of the head also thins, often progressing to baldness. In women, though, androgenic alopecia begins with gradual thinning at the part line, which is the side part, followed by increasing diffuse hair loss radiating from the top of the head, of the woman's head. A woman's hairline rarely recedes, and women rarely become bald. There are many potential causes of hair loss in women, including medical conditions. We spoke about thyroid. Thyroid is a condition, is a culprit here. Medication, some medications that we use can cause hair loss. And physical and emotional stress. Stress is a very big factor in health. And one of the things it can cause in women going through the menopausal symptoms is hair loss, female pattern hair loss. If you notice unusual hair loss of any kind, it's important to see your primary care provider or a dermatologist to determine the cause and appropriate treatment. You may also want to ask a clinician for a referral to a therapist or support group to address emotional difficulties. Hair loss in women can be very frustrating, but recent years have seen an increase in resources for coping with the problem. So, how to stop hair thinning, hair loss treatment for women. Medications are the most common treatment for hair loss in women. They include the following: minoxidil, which is otherwise known as Rogaine or the generic versions. This drug was initially introduced as a treatment for high blood pressure, but people who took it noticed that they were growing hair in places where they had lost it previously. Research studies confirm that minoxidil applied directly to the scalp could stimulate hair growth. As a result, the FDA originally approved over-the-counter 2% minoxidil to treat hair loss in women. Now, since 5% solution has also become available, which is a stronger solution for women's hair loss. Clearly, minoxidil is not a miracle drug. While it can produce some new growth of fine hair, not in all women, it resolves the problem of full density. When they have full density hair loss, it's not a quick fix either for hair loss in women. You won't see results until you use the drug for at least 2 months. The effect often peaks at around 4 months, but it could take longer. So plan a trial of 6 to 12 months for yourself. Now, if minoxidil works for you, you'll need to keep using it to maintain those results. If you stop, you'll start to lose hair again. So be sure that your hair, how to use minoxidil is to be sure that your hair and scalp are dry. You'll have a dropper, and using the dropper or a spray pump that's provided with the over-the-counter solution, apply it twice daily to every area of your hair where thinning is noticed. Gently massage it into the scalp with your fingers so it can reach the hair follicles. Then air dry your hair. Wash your hands thoroughly though, and wash off any solution that has dripped onto your forehead or face. Don't shampoo for at least 4 hours afterwards. Some women find that the minoxidil solution leaves a deposit that dries and irritates their scalps, called contact dermatitis. It is probably caused not by the minoxidil itself, but rather by the alcohol that is included in the product, which facilitates drying of the scalp. The side effects and concerns. Minoxidil is safe, but it can have unpleasant side effects, even apart from the alcohol-related irritation. Sometimes the new hair differs in color and it differs in texture from the surrounding hair. Another risk is hypertrichosis, which is excessive hair growth in the wrong place, such as the cheeks or the forehead. This problem is more likely when women use the stronger dose, which is the 5% solution, rather than the less potent one, which is the 2% solution. Because the patent Unrograin, which is the brand name version of minoxidil, has expired, many genetic products are available over the counter right now. They all contain the same amount though of minoxidil, but some include additional ingredients such as herbal extracts, which might trigger allergic reactions. So it is important to do your research, to talk to your healthcare professional, talk to your doctor. So if you want to add minoxidil into your daily regime, note that it is something you'll have to use always, because if you stop using it, the hair loss will return. So this is one solution that women have. Anti-androgens include, which is another, include testosterone and male hormones, which can accelerate hair loss in women. This is another problem. Now, some women who don't respond to minoxidil may benefit from the diuretic drug spironolactone, which is otherwise known as aldactone, for treatment of androgenic alopecia, because this drug has anti-androgen properties. This medication is especially helpful for women with polycystic ovaries who are experiencing otherwise known as PCOS, which is the shortened abbreviated version, because they tend to make excess androgens. Doctors will usually prescribe spironolactone together with an oral contraceptive for women of reproductive age. A woman taking one of these drugs should not become pregnant because they can cause genital abnormalities in a male fetus. Possible side effects include dizziness, excess thirst, loss of appetite, weight gain, loss of libido, which is, that is our sex drive, and we already experience a loss of libido going through the menopausal process, and this will further aim to reduce your libido. And fatigue. If aldactone is not effective, another medication with an anti-androgen property such as finasteride may help. So let's look at iron supplements now. Iron supplements. iron deficiency could be a cause of hair loss in women. Your doctor may test your blood to check your iron levels, particularly if you are vegetarian or have a history of anemia, which is anemia is there are different types of anemia, but that anemia would cause you to have a lower than usual blood count, which can contribute to hair loss. Or if you have heavy menstrual bleeding, which could also lead to anemia and low iron levels in the blood. If you do have iron deficiency, you will need to take a supplement and it may stop your hair loss. However, if your iron level is normal, taking extra iron will only cause side effects such as upset stomach and constipation. Other treatments. If other treatments are not effective, laser therapy or platelet-rich plasma injections may be recommended by your healthcare professional. Hair transplantation. Hair transplantation is a procedure used in the United States since the 1950s to treat androgenic alopecia. It involves removing a strip of scalp from the back of the head and using it to fill in a bald patch. Today, 90% of hair transplant surgeons use a technique called follicular unit transplantation, which was introduced in the mid-1990s. During this procedure, surgeons remove a narrow strip of scalp and divide it into hundreds of tiny, tiny grafts, each containing just a few hairs. Each graft is planted in a slit in the scalp created by a blade or a needle in the area of the missing hair. Hair grows naturally this way in small clusters of 1 to 4 follicles called follicular units. As a result, the graft looks better than the larger plugs associated with hair transplants of yesteryear. Not everyone with female pattern hair loss is a good candidate for this too, for hair transplantation, especially if hair loss is widespread and severe. In addition, hair transplantation is very expensive and can be time intensive and is not always successful. So these are this is a very another solution that is used to help women through this period of struggle during menopause. Anybody has any questions? We are quiet tonight. Any questions? Dr. Khan?
I'm here.
Okay.
So no questions tonight?
Everybody's
Nobody
just quiet, not hearing.
Nobody has any comments to say about hair loss? Is there anything else to add, Maria?
I want to talk about some vitamins for hair and skin health during menopause.
Awesome. Let's dive into it. So I use Rogaine with my hair for a little while.
And did it help?
Didn't work. Nope.
It didn't work.
So when you talk about hair loss, I have quite a bit of it. Mine is genetic.
Okay.
So I understand the plight, but I had no turning back. But that's hair loss in men. Hair loss in women is very different. Only a very few women that suffer the hair loss in men go through. Ours is based on testosterone. We have too much testosterone at the top, so the hair just can't keep up. But let's dive into some of your remedies for hair loss, Maria. And if anybody has any questions, put your hands up or just put it in the chat and I will monitor it and bring it to Maria's attention. So you're all yours, Maria.
Okay, so I want to deal with vitamin A for dry skin and hair during menopause. During menopause, dry skin can have even your thickest moisturizer struggling to make a difference. That's because the estrogen stimulates your production of oils. That is one of the losses we go through when estrogen is reduced during menopause. So that oil production that helps your skin retain its moisture is reduced. With less of them during menopause, you would find that itchy skin and dry spots can show up from head to toe. Your hair feels the effects too, since vitamin A is needed by the body to make sebum, which is a natural scalp conditioner. Get your vitamin A, which you can get it for those who use animal products. You can get vitamin A from products like salmon and goat cheese. And as well from orange and yellow vegetables. They are high in what is known as beta carotene. So vegetables like carrots and sweet potatoes. Vitamin C is important here, which can be used to boost collagen production. Estrogen stimulates collagen production. So age-related changes in estrogen levels can cause a natural decrease in collagen levels, showing up noticeably as wrinkles, sagging skin, and even less support for the hair shafts, which in turn will cause hair thinning. Help support and replenish this protein with vitamin C, which helps collagen production. You can get this helpful vitamin for skin and hair from citrus fruits, oranges, strawberries, peppers, broccoli. Foods with vitamin C can also help in the absorption of iron in your diet. So pair them in a meal together as much as you can. Healthy fats as well for moisture. Healthy fats like omega-3 fatty acids are fats that are good for supporting your healthy heart, maintaining already healthy cholesterol levels, and aiding in overall health and wellness, and getting your glow back by nourishing and moisturizing your skin. Keep your diet rich in omega-3 fatty acids, also important, because your body can't make omega-3 fatty acids on its own. You'll find them in sources like fish, nuts, seeds, plant oils. You can also choose to supplement with fish oil if you prefer. Protein for hair growth as well and skin support. When it comes to menopause, hair loss, sometimes you are what you eat. Hair is made of protein strands, and deficiencies have been linked to hair shedding and brittleness. As your estrogen naturally declines, hair growth can also slow down. Skin can take a hit too. Your body turns the protein you eat into amino acids, some of which help exfoliate dead skin, make collagen, and protect you from the UV rays and from free radicals. Fight menopause, hair changes, and skin changes with protein from products like legumes, nuts, seeds, and whole grains. Biotin for healthy hair. One of the best vitamins for menopause hair health is biotin, otherwise known as B7, which is part of the B complex family that helps our bodies convert food into energy. Biotin deficiency has been linked to hair loss and loss of hair color, which is graying. One study found that 38% of women who said they had experienced hair loss were deficient in this B vitamin, which is biotin. We get this into your diet through egg yolk, nuts, legumes, whole grains, cauliflower, mushrooms. addressing iron deficiency for hair loss. Iron deficiency contributes to hair loss as it disrupts the nutrient supply of the hair follicle. This can lead to more hair shedding, potentially leaving you with overall thinning, even bald spots. So, to reduce menopause hair loss, you can prioritize keeping your iron levels up by eating meat like chicken, having fish, as well as incorporating veggies like lentils, spinach, and leafy greens. So ladies, I hope these solutions, and gentlemen who are listening, I hope these solutions that I gave were very helpful, because this is such a wide topic. There are so many things we can talk about when it comes to hair loss. But these solutions are some of the best and the healthiest and sources of natural information through diet, lifestyle, stress management that can be incorporated through visiting and consultation with your healthcare provider. And as I said before, do not start taking anything without consulting your physician to know if, especially if you are on medication, if there would be bad reactions to the medications that you already are on. So it is good to consult your healthcare provider before taking even the supplements, because they will take blood tests and check do a full blood test, CBC, and all these things to see what is the cause before starting anything. So you need to know what is the cause of the hair loss, whether it's genetic, whether it is through menopause, or through the medication itself that you may be using, or other means. So it is very good if you have concerns here, you have problems with hair loss, that you consult with your physician and you all can have conversation regarding to the best solution for your issue. So this is the topic that we are dealing with tonight. Any questions, Dr. Khan?
Yes, ladies, any questions? Gentlemen, if there are any here, any questions about managing your hair and things you could use to help you? So you could always unmute yourself and just ask the question if you want. So all right, fair enough. So since there's no questions, before we go, I will have a few announcements to make. For those listening on YouTube, we are in the process of launching our mini courses on our app. This may take a couple of weeks to get done, and then we will have the app up on YouTube and on the website for you to join in on mini courses on different things you can do to help with the different symptoms of menopause. And the courses are meant to help you along the way. They'll range in costs, but we haven't decided on those yet, and we will have them in package deals also. So that's it for us on YouTube and being present here. For those living in Trinidad and Tobago, which is where the White Rose community is located, we are launching the clinic on Saturday. And as mentioned last week, we are offering. Alberta asks, Alberta Alexander, has anything on thoughts on brain processing as affected by menopause? Yes, there's lots of thoughts on brain processing, but before we get there, let's talk about the clinic. So the clinic launches this Saturday. We're going to start from 9 a.m. to about 2 p.m. And as we mentioned last week, we're offering pap smears, breast examinations, a medical consultation, and we're going to do some of the blood tests you need to confirm whether it's menopause or if there are any other underlying issues that might be leading to some of the symptoms that mimic what menopause does. So if you have anemia or anything like that, then we are going to give you the advice and everything you need. We're also going to bring in the supplements you need. And if you're on our WhatsApp group, which I hope you are, I'm going to share the link here again. Give me 1 second. Join our WhatsApp group. We're going to be posting it to the group about the updates for the clinic and for you to give us I'm just getting the link. The link is also on the social media channel on YouTube, and you can get to the YouTube channel through the Healthy Reset. So so on the link, let me just put this here. This is the link for the WhatsApp group, right? You'll get some updates. We will start this week pre-selling our packages. We will start pre-selling our packages of supplements. Oh, we have somebody here from Jamaica. That is awesome. Yes, we have a website. It's called the Healthy Reset. I will post it here in a moment. This is also, you can go on the website if you're having a problem finding the YouTube channel. You can go on the website and you can find it. In Jamaica, you can also join our WhatsApp group and get updates, and you'll be able to get we can also get the supplements to you if needed. So we're going to pre-sell sell some of the supplements packages we're creating. You'll get that update by latest Friday. If anybody wants any supplements, if you don't purchase before you come to clinic on Saturday, you can always tell us and we can organize it for you and have it ready for you in a timely fashion. We're still in the process of setting up many of these things. Now, so Saturday, 9 to 2, we are offering the first 10 women a free breast examination in addition to while they do their with their pap smears. Right? So when you come in, you do your pap smears, you do your breast examination, it's totally free, and then we do a quick medical visit and any suggested blood tests you may need to confirm any issues you're having. Right? And we're going to be bringing more and more stuff into the clinic, like massages, bringing in a sports and exercise medicine specialist to deal with joint pains, arthritis, all those things. And we have many, many things planned in the future. Now, so if is anybody here interested in having their pap smears done on Saturday, you can either send me or Nurse Maria a message through the WhatsApp group, or you can just raise your hand here. Is anybody interested? Okay, no takers. All right, no problem. Right. So then so you can always send me or Nurse Maria a message. You can always send me or Nurse Maria a message and we will get you on the list for pap smears. We're offering the first 10 women free breast examination. All right, let's get into some of the questions that are asked. So Maria, question asks, sometimes I start, oh no, let's go to the top. Let's go to the top question. All right, so the first question, any thoughts on brain processing as affected by menopause? So, Alberta, this is a big topic. Yes, and brain fog and brain processing is a major problem. What we can do is next week you have another guest speaker. Tonight we were supposed to have a guest speaker speaking on brain processing, but unfortunately she had to cancel because of an emergency. So what we next week we have a breast guest speaker. What we'll do is we'll create a group of shorts on brain health and brain processing that we can give you a lot more details than we can in this short time here, since we want to focus on hair loss. Right? I know I didn't answer your question, but there's a lot to go into there in terms of what improves brain health. Like, so one of the supplements or groups we're bringing in is going to be brain health supplements, which is your magnesium, your omega fatty acids, and vitamin D. Maria, you want to add anything to that?
Not just yet. No.
Okay. All right. Alberta, we will get to that question, I promise you. But it's a big topic, and I want to do a whole segment on just that alone. to give you as much quality information as possible, but in the short space we can. So my recommendation is omega fatty acids, very good for brain health. You can get those in, we can get those in fish, olive oil, avocados, are very rich in things for brain processing. All right. So that's some of the things, and we will get deeper into that topic as we move forward. All right. The next question. So he said, good question. Sometimes I start, yes, Lisa. Bravo, Lisa, since you asked the question, sometimes I start an argument and I get lost mid the argument. And you have your hand raised. Go ahead and ask your question. And since you were the second on the list anyway, let us know what you're talking about, what you're saying.
No, like good evening, everyone. Like
Good evening.
like you're having like this really intense discussion with someone, and you know it's a compound response you want to give. So you have like a first layer and a second layer. So sometimes you've given them the first part of the argument, and you're like, where is the story going again? And you have to like take a check and say, oh yeah, that's what I was going to about. And then I have to go back. So yeah, I'm just wondering if that was
Part of menopause.
Alberta's question. That's it.
Yes, it's part of the menopausal symptoms. Even up to today, I went to get something in a room, went in the room and had to go back outside and come back in because I had forgotten what I had gone in the room to do. It's same things that relates to argument, talking with someone. You start to talk about a topic and then you forget what topic that you were on. All of that is what we call
Is a part of it.
brain fog. Yes, it is. It's just that's a part of it, you know. So it is something that we go through at this phase with the menopause transition. So we work on these things. That is why we keep saying this is something we work on through diet, through stress, because it could be a lot of things that can initiate it. To me, if I'm more stressed out, I would have more brain fog.
Okay.
If I'm less stressed and I get that stress under control through exercise, which is a very big part of a stress reliever, through prayer, through meditation, through yoga, some form of stress relief, it tends to decrease. So, and another thing can cause all that brain fog too. If you're not sleeping well at night, yes, whole night you're up due to the insomnia that is caused by the same menopause. That could be factored in as well to the brain fog. All these can contribute to brain fog.
Yes, brain fog is a challenge. I mean, especially with the change in menopausal symptoms. But there are techniques. There are techniques you can use to both improve your concentration, decrease those lapses. And there are supplements you can take, and nutrition you can use to really improve your brain health through the transition. And there's actually a little bits of things like reading. Regular reading actually improves brain fog, and keeps you more focused. And there's techniques you can use, and we're gonna get deeper into those techniques when we do the segment on reducing brain fog and improving mental resilience, right? One of the things that can lead to brain fog also is stress, overwhelming stress, work stress, burnout, all those things can lead to developing severe brain fog, right? So there are things to do, but have no fear, we will have them available for you. So as I said, join us and we will continue to serve you as best as possible. All right. Sorry, I'm sound a little bit distracted because I'm trying to add stuff today. All right, lots of questions coming in now. All right, so let me get to these questions. All right. All right, so let's get to these questions. All right, so brain fog. Lots of questions on brain fog tonight. Right. 1 second, ladies. I like it. I'm trying to manage several things at the same time, so I'm not getting brain fogged. All right, so. All right. Sorry, my daughter is showing me a book now. Thank you, Dodo. I usually pull my hair out if I see it growing on my chin. Is that safe? So Maria, is that safe?
I would suggest that she gets a professional to do it.
I
Because,
also suggest that.
yes, because it could cause, you see, dealing with skin and hair issues and anything like pulling out stuff. Some people say, I see a nail growing in a funny way, in a way that is uncomfortable. You try and cut it and it could cause other issues. So I suggest you have any extra hair on your chin or anything like that, you check your healthcare provider who can put you onto a specialist who could further deal with these issues. Don't try to do these things on your own because you can get yourself in a whole heap of trouble health-wise. I've known people that squeeze pimples on their face and eventually they turn, with some people according to if their hands are dirty and what bacteria they pick up, those can cause very bad side effects and can even lead to things like abscesses. I've seen cases as extreme as that just by squeezing a pimple. So let the healthcare professional, you have problems like that, you have an issue like that chin here, let the professionals deal with it. Don't try to pull it out or do your own stuff. It can make the matter worse.
I would add to that instead of trying to pull it out, because as Maria says, you pull it out and you can break the roots of the hair. And that little piece in there, it could die and cause the infection. So I would suggest just trim it or shave it off, right? And and that's not a problem. Another thing you could go to a professional and they will wax it or remove it by doing it in a proper manner. So definitely get a professional help on that. But I would suggest pulling it as much, but using for in the meantime, just to shave it off or clip it with a scissors, and that should be good enough. Is there a combination of supplements just for menopause only? Maria, all you.
There is a number of combinations. But the basic ones that can be used, which since I've been going through it, that I find to be very helpful is I use omega-3 capsules, which I also incorporate omega-3 rich foods. Like I use chia seeds, I use flax seeds, I use salmon, and to help my omega levels, because I am a person don't use I don't use chicken or beef or anything like that. I use is fish, basically. So I had get my omegas through those oils. I also use oils like coconut oil. I use avocado oil. So I get my omegas through those sources. That is one. And we know the omegas it helps with heart health. It helps with joint pains and things like that. You have to have that omega level up. I also use magnesium. And the magnesium that I use, because there are a number of magnesium products out there, but the magnesium that is helpful a lot of the times during menopause is the glycinate or bliss glycinate. It helps me and other folks in cases of insomnia. And when you cannot sleep at night, you cannot function well during the day because you don't sleep well. And what it can cause too, it can cause you to gain weight because of the lack of sleep, which increases stress and that belly fat that we're trying to get rid of during menopause. So the magnesium glycinate is a good product to add during menopause. It is good for males and females as well. So those are two of the regular ones that I use on a daily basis, as well as the vitamin D3. I use those on a regular basis, and that combination has really helped me a lot, along with a full lifestyle change. Because what I would like to say though to everyone listening, it is not a one approach solution. You have to make certain lifestyle change, which incorporates the mental, emotional, physical, psychological well-being in order to get these symptoms under control. So it is a lifestyle change. So you're looking at things like stress management, which is one of the main factors to get a lot of these issues under control. So stress management is a key factor to help balance off a lot of the imbalances during this menopausal period. The diet is another factor because it helps to add a lot of the things that are missing during menopause because of the lack of the estrogen and progesterone levels, how they are decreasing. So it is a whole lifestyle change, folks. So these are some of the things that I do, that I incorporate myself. And as well as the iron supplement. I take iron as well because I am anemic. So the iron as well helps as well with the hair loss that I've been experiencing for quite a number of a few years now. So it is helping, but it is a process. It is not a quick fix. So you have to be consistent in order to see changes. I hope that answered the question.
And to add to that a little bit, that's why we're building this community, because we want to give that consistent change to women. Now we are going to build a stress management program for helping women to manage the changes in menopause and the burnout you can go through with going through the menopause changes. Additionally, we are going to have these supplements in the clinic. We're going to have the recommended supplements that women need through menopause. We're going to have the recommended combination of supplements that you can use through menopause. So we'll have them in the clinic and we'll have them available to you. So you just have to order them for us and we'll get them to you and you can start using them on a regular basis and renew your orders as you need to be. All right. And we're trying to focus it on specifically what women need going through not just menopause, but that midlife change. Right. As you get older, as the metabolism starts to slow down, as you know, different things are happening in your life, you need to adjust to match those different shifts in your life. So we will have those things recommended for you so you can be very cognizant that these are the things you need to take at this point in time, right? So going on to the next question. Should I take vitamin C and D3 together, Maria?
Vitamin C, and D3. No, I've never combined the two together as well. But what I know that when you're taking your vitamin C, it works better with food, the vitamin C. But the D3, I've never taken two at the same time. So I would see if Dr. Khan may be more knowledgeable in the combination of those two in particular, the vitamin C and the D3 at the same time. And what we could do, we could probably look into the combination of supplements as well, so that I could give you a more rounded answer on a later program, because this is not guesswork, right? So I want to give you the right information with the right research that goes behind that. Dr. Khan?
Sorry about
What's
that. Um,
yeah.
So
I'm hearing somebody.
yes, I'm
Yeah.
hearing somebody also.
My
Who?
name is Lisa, and I asked my doctor a similar question. So she put me on this thing called Nature's Way Alive Women's 50 Plus.
Mm-hmm.
I look on the back, it does have vitamin A, D3, and vitamin C. But the vitamin C is 33% of the daily requirement, and the vitamin D3 is 200%. So in this particular formulation, they seem to have combined it with the biotin as well.
So yes, you are correct, Lisa, and thank you for that. Yes, you can take vitamin C, and D3 together. Combination wise, they're even more powerful, right, in terms of enhancing the immune system. So there's no contraindication to it if you have a good supplement of vitamin C and D3, but also it comes down to having a good quality vitamin C and D3 also. And that is a key element there. And that's what we're going to try to do in the clinic is bring in good quality vitamin C and D3. It gives you the recommended dose that you need for achieving what these vitamins can do for you. All right. So going on to the next question. I'm 41 years old and started having headaches, feel like migraines, sometimes before, sometimes during my period. Is this symptom leading to menopause? What vitamins do you recommend? This is coming from Stacy Ann. All right, you go ahead and start answering this one. I'll be right
Okay.
back in a sec.
You are at the age, but what we usually some of the symptoms start as early as in your early 40s. During one of our previous shows, there are women, according to what goes on genetically with the women in the family tree, there are some women who start as early as in their mid-30s, right? And the only way you would
Oh, I think we lost Maria there for a second. So I guess what Maria was getting into, I think she'll be back in a moment, is Stacey Ann. Menopause can start, as she said, as early as your 30s. So what I would recommend is let's confirm whether it is headaches coming from migraines or and it's specifically that, or it could be something more. So what I would suggest is come in on Saturday and see us in the clinic, and we'll do an evaluation of what's going on with you, and then in addition to that, we'll do some blood tests to confirm. And there are blood tests you can use to confirm whether it is or is not menopause you're going through, and we could also rule out some of the issues that might be mimicking menopause or other things that can cause you to have migraines and headaches, and also put you on a treatment plan that can help you to reduce the impact of migraines. And if it is migraines, it is manageable. There are things you can do to take care of migraines and avoid the prodromal of symptoms. That's the stuff that comes before the migraine comes along, how to recognize it and so on. So I suggest come and see us on Saturday. As I said, the directions are on the website. Just go to the members section. You'll see the directions there. Come and check us, and we'll go through the gambit and see what is going on with you, Stacey, Stacey Ann, if you don't mind. All right. So, Stacy here, she says, thank you. She will come and see us. Awesome. So, the next question, do women go into medically induced menopause due to surgery, for example, having a different intensity of menopausal symptoms compared to natural menopause? This is coming from Alberta Alexander. Maria?
I'm sorry about that just now. What happened? The laptop discharged on me. So I'm using another medium right now. Sorry about that. What would make it more intense that you are a woman who was not going through menopause, for example, if you had a total abdominal hysterectomy, it would automatically put you in menopause. And yes, it would be more intense to you because you never had those symptoms before. It would be just like a flood of symptoms. You start to get these hot flashes, the cold sweats, the insomnia. It would seem as well to you as if everything is happening at the same time because your body more or less is going through this transition and it was preparing for such a quick fix like women are going through it on bit by bit by bit phase. So it would appear that it would be more intense for someone who never had the subtle changes. So they would have it a bit harder. They would have that anxiety, depression would come on because the body was prepared fully for this transition. So yes, to that a person like that, it would seem more intense, but actually the symptoms would be very all would be very similar to a woman who is going through the menopause, but it's just that it comes like a flood because your body never went through anything like that in such a quick manner. So it was like it's something you're going through and you weren't prepared, and everything just seems to be happening at the same time. So it would appear that everything would be more intense to someone like that.
Yes, I do hope that answer was helpful. As you can tell, yeah, yes, there is what's called the total hysterectomy, is when we remove the ovaries, can send a woman directly into menopause. But if they kept the ovaries, then you can transition into menopause. It might not be any faster than normal. So yes, that can happen. So I don't have any more questions coming in the chat. Does anybody else have any questions they want to ask at this point? So if there's no more questions, it's getting late, and I know everybody's getting ready for bed, and having a pleasant evening. So I'm gonna wish you all a pleasant good evening. Remember, the clinic starts on Saturday. You can come in. We do have walk-ins. Come in and check us out. Even if you come by just to chat and visit and with us, that's perfectly fine too. As I said, we're offering the first 10 women who do their pap smears a free breast examination. If you're coming in just for the breast examination, that's okay too. We're offering 10 free breast examinations, in other words. And we will be available for 9 a.m. Check the website. I posted it earlier. Check the website. The directions are on there. Join our WhatsApp group and you'll get the updates about the clinic. And then we also have the supplement store open. So if you need to order your supplements, just let us know and we'll get everything prepared for you. We will post what supplements packages we have available by Friday latest. And then you will have all of this information available to you. Thank you so much for coming this evening. Maria, do you want to close off?
And we hope that we are helpful to you during this transition, whether you're going through the perimenopause, the menopausal, and or the postmenopausal section of part of menopause. We hope that we are helping you during this time, and that's what we are here for. So I want to thank you for your support as well, ladies and gentlemen. Pleasant night to all.
All right. Have a great evening, ladies, and we'll see you next week. We're having another amazing speaker coming on. I'll have the information up by tomorrow. And looking forward to having you again. Thank you for this evening and have an awesome evening. And thank you for seeing us on the Healthy Reset. Good night.